Welcome to this training video on the HEE assessment strategy, which is available on the HEE website. This video is about the learning needs analysis and personal development plan. What is learning needs analysis and personal development plan? A learning needs analysis enables trainees and their supervisors to identify and prioritise the trainees' most important and urgent learning needs. After undertaking a learning needs analysis, the trainee and designated supervisor must develop objectives and actions that are individual to the trainee, establish priorities that are relevant to practice, and allow evaluation of progress using the personal development plan. The learning needs analysis and personal development plan are assessment activities that are required to be completed as part of the HEE assessment strategy. As well as supporting the planning of learning and development, completion of these activities actually provide evidence against some of the learning outcomes. When to use and preparation needed. During the first week of training, the designated supervisor should meet with the trainee to support the completion of the learning needs analysis and personal development plan. This must be repeated at weeks 26. And will also be available at weeks 13 and 39 should the designated supervisor and trainee wish to complete it for each of the GPHC appraisals. The learning needs analysis is the preparation and forms the basis for the personal development plan. The learning needs analysis is used to identify the gaps in the trainee's learning and development. When the trainee is exploring their learning needs, the first thing they need to consider is what they would like to achieve. Thinking about the skills, knowledge and behaviours that they have developed so far, and the most important of these that they need as a foundation pharmacist. How to use the learning needs analysis. The learning needs analysis consists of a table of the GPHC learning outcomes. Next to these outcomes is the level from the Miller's triangle for these outcomes, for example, shows how or does. Firstly, the trainee needs to assess these outcomes against their current ability. This could be low, medium or high. Low says the trainee does not have the knowledge, skills or experience to demonstrate the learning outcome yet. Medium, the trainee has the knowledge and skills or experience but has not had the opportunity to fully demonstrate this at a required level. High. The trainee has the evidence to show that they have the knowledge, skills and experience needed to consistently demonstrate this learning outcome at the required level. So let's look at an example. For learning outcome 7, obtain informed consent before providing care and pharmacy services, the trainee may rate themselves as low as they have not provided pharmacy services before. However, for learning outcome 6, treat people as equals with dignity and respect, they may rate themselves as high, as they have done equality and diversity training and also shown this on every day of their training so far. Once the trainees have rated their current ability for each of the learning outcomes, they then need to rate the relevance of each of these learning outcomes to the training at the time. It is worth highlighting here that although everything is relevant, in this context we mean relevance to their training plan to help them prioritise their learning. For example, quality improvement is important, but if they are not doing this until after week 26, we would not expect this to form part of the personal development plan in the first 26 weeks. So looking at the examples we had before, learning outcome 7 may be rated as highly relevant as the trainee has begun to provide pharmacy services. Learning outcome 6 may also be rated as highly relevant as treating people as equals will be relevant when dealing directly with patients accessing the pharmacy services. So once the learning needs analysis is complete, the trainee must identify the learning outcomes which they have rated as low or possibly medium and that are highly relevant to their practice at that time. These will be pulled automatically into the personal development plan in the e-portfolio. They need to look at a maximum of 30 learning outcomes for the personal development plan. This number is based on completing the personal development plan twice in the year. If the designated supervisor and trainee decide that they will undertake this more than once in the year, then the number of learning outcomes per learning needs analysis may be reduced. After each new learning needs analysis, a new personal development plan will need to be created. How to use the personal development plan. Using the example from above, the trainee identified that learning outcome 7 was low ability but high relevance, so has identified it as a learning need. Firstly, the trainee needs to put learning outcome 7 in the first column. This will be pre-populated on the e-portfolio from the learning needs analysis. Please note that the learning needs analysis and personal development plan may look slightly different on the e-portfolio, but will still be required to be completed in the same way and require the same information. The required level for this outcome is does. Now the trainee needs to decide on the actions they must complete to address this learning need. This requires them to come up with some SMART objectives. For this example, a trainee may say that they will complete 3 discharge medicine services. This will be evaluated by asking their supervisor to assess their communication with the patients and provide feedback on obtaining consent. The deadline for this would be at the community pharmacy placement next month. We can see that this objective is specific, measurable, achievable, relevant and timely. Please note that the trainees can do more than one activity to meet the learning outcome. This is just one example. The trainee would then complete the personal development plan with the other learning needs that they have identified. At the end of the personal development plan is the BRAG status for the completion of the learning outcome. B in BRAG stands for blue, which means complete. G stands for green, which means on target. A is for amber, which means that there's a risk of it not being on target, and R is red, which means it is not on target. The designated supervisor needs to make comments on the personal development plan, so the trainee and designated supervisor need to arrange to meet to discuss it. The trainee then needs to complete and sign off each of their activities and action points. The designated supervisor signs off the whole of the personal development plan when they feel that all the actions are met. This is at the discretion of the designated supervisor. So again, the trainee and designated supervisor will need to have to meet to discuss this. This means that if 80% of the actions are met and the designated supervisor feels that this is satisfactory, the PDP can be signed off. It's worth noting here that the trainees do not need the PDP to be signed off before they start another one. However, we do recommend that this is the case so that all the actions are completed and evaluated, and this avoids any confusion with multiple PDPs. For further information, please see the HEE Trainee Pharmacist Foundation Year Assessment Guide and Strategy on the HEE Trainee Pharmacist website. Within the guide, there are suggested activities for each of the learning outcomes, which should help develop the PDP. There are other resources available as well, such as on SMART objectives. For more information on the GPHC learning outcomes, please have a look at the GPHC Foundation Training Manual on the GPHC website.